here we're talking about a lot of stuff that's going on with the president and within the city of New York, and even with the governor in California, talking about this whole idea of these mandates going on where people have to get immunized if they're going to be able to operate freely within society. And so I want to ask y'all, what do you gentlemen think about that? And that this goes out to whoever wants to start.
Well, I'll jump on that. Oh, go ahead, Terrence.
No,
you got that?
No. But figure it's very rare that I start. I'll start saying that certainly this was inevitable with the scope and the transmissibleness, if I made that word up, of the disease or the virus. It was inevitable that there was going to be some kind of pressure on people to get this vaccine or suffer some social consequences. Whether it's ethical, whether it's principled or not, this was handwriting that was written on the wall for a long time. There is also legal precedent for the state mandating vaccines at different levels for different reasons. So with that ground already covered, it was just only a matter of time before we see the widespread mandates for travel and public events and schools and so on and so forth. And now some businesses are requiring, private businesses are requiring that their employees be vaccinated if there's no alternative for remote work. So it's something that was coming down the pike a long time.
And as far as the research goes, we've now seen that people who aren't vaccinated run larger risks of everything, and of across the spectrum of, like, if they caught COVID. Now, I mean, it's the same pharmaceutical industry that I have loathed for generations. I mean, this is the same one. We didn't forget, but the whole idea is that, like, if you go back and you look at what in the 20s, well, they said about, like, what was going to happen with the vaccine and the reasons for the vaccines and so on and so forth. And it's, oddly enough, 100 years ago, it was almost the same kind of rhetoric. They were releasing them to thin the herd. There was all kinds of things that were in it that was supposed to happen. Now, 100 years later, we know that a bunch of that stuff did not happen. So we have to just look forward to the idea of, like, where are our risks? Myself, as a teacher in the South Bronx was the epicenter of the epicenter, and still has a lower vaccination rate than most places, a higher death rate than the rest of the city, and so on and so forth. So there was no way that like, so I'll be vaccinated on Friday, so that way I'll be ready for going back to school in September. People got to do something.
I would just add that, here in California, you've had Gavin Newsom sort of really lead after following London Breed's response at the city level of the country in terms of, the big states and how they performed in the original waves of COVID. I'm saying everything before this Delta virus.
James London Breed is the mayor of San Francisco?
Right, the African-American woman mayor of San Francisco. And, she got a lot of stars apart from messing up and going to a restaurant in Napa Valley that Gavin Newsom also went to, the governor of California, after they both told everybody else stay home. So that was a big credibility problem for them. But they otherwise, if you compare, I've seen data that show California compared to big states, Texas and Florida, and the shutdowns in California allowed it to fare better in the short term, at least up to this point. If you look at the Spanish flu, two cities that they compared were, I've seen comparison to, is St. Louis and Philadelphia, and how they both performed, how St. Louis would not shut down, Philadelphia did, and you had this complete, different result in terms of, people being affected and people and recovering, right? And like Brother Darrell said, a lot of people in our own community, for different reasons, legitimate reasons, and also poorly informed reasons, But beyond our community are sort of, reluctant toward these vaccines because the government doesn't have a good record. In many areas, we've read, we've had books that are thicker than the Bible on medical apartheid, right? We know about infant mortality rates with Black women and newborns, Black women dying in birth disproportionately, right? We know about life expectancy amongst Black men compared to others. And in the 80s, the 90s, we were all old enough to remember that depressing news comparing Harlem. So I think, when you start thinking about why we're in this Delta virus stage, I don't want to blame anyone because I'm not a medical expert and I don't want to begin to talk about any of this medically, right? I think a lot of it comes out of political ignorance and political ideology. And that is where I do come in. And when you look at the blue state, red state divide, going back to Trump's comments that if we just sort of let the blue states die out, we'll get rid of the virus, right? And then we saw this whole formation, to use Beyonce's term, around Trump and the MAGA ideology around vaccines and the red states and their governors like DeSantis, this awful man in Florida. And then you see the other awful performance of leadership in Texas, right? Where these governors of these large states, where our people are disproportionately in these red states, Black people are overwhelmingly, 60% of us are in the red states, and going back with the Black migration that's happening right now, right? And yet so that's where there's this reluctance for the most part. We have our own ignorance in our own community where people are reluctant because of past abuses. People will cite the Tuskegee experiment. People will talk about, AIDS and HIV. All right, Dr. Fauci was the main point man on that development back in the 80s. And so I think part of the problem is it reflected in my comments, is multi-layered.
Right.
Right.